There are some conditions that when you are in the hospital with some types of conditions, doctors will run some tests and they'll tell you, you're not going to survive in the next 2 or 3 weeks. They know. Yeah. So when you see that the kidney starts failing, the heart starts failing, the liver, and then anything that goes to the brain and everything is deteriorating, just know that that is a very bad sign. Say as Kenyans, we don't love ourselves. Most of us. Yeah. We don't love ourselves because you'll find that something is bad, but you'll still go and do it. Yeah. You know something is bad, you still go and do it. So there are things that we bring to ourselves. Again, I think poverty also plays a role. The STIs mostly. Yeah.
So far sasa tunaweza simama hapa na tuseme Embakasi STI inatembea vibaya sana.
Vibaya sana. Yeah. Because people share women. Yeah. And people share men. Yeah. Sharing is caring. Yeah. So also when you have gonorrhea, then you give it to me, you are now caring.
Tusaidiane tu.
No, sharing is caring. Yeah. When you share with me your gonorrhea, is it caring?
Tunasaidiana. Mwanaume kidogo kidogo kila mtu
apate. No, is it caring?
Kidogo kidogo kila mtu apate, doctor. Kidogo kidogo kila mtu apate.
It depends. What is this that unapata?
Welcome to the Mortician Talk, and today I have a very special guest. Pia kama kawaida nitaacha introduce ambaye tunataka ku dive in the matter of health. Yeah, about the living and the dead. So without wasting of more time, my guest, kindly introduce yourself.
Thank you. I'm Dr. Odhiambo Bueno. I go by Dr. This. I'm a reproductive health specialist and gynecologist by profession. I think that's just enough.
Gynecologist.
Yeah.
Feel at home tafadhali.
Thank you.
Yes. Unaweza sweep kama uko na maji tafadhali, you take time. Ndio tunaanza sasa. Gynecologist.
Yeah. So anything pertaining to the female reproduction. Anything. Yeah.
Hey. So audience tafadhali, are you ready? Yes, are you? Very. So today maybe tuanzie kwanza na like ulisomea wapi, the journey hivyo ndio tujue una kwanga wapi. Unajua kwa wengine pia wako like Dr. Odhis located wapi, where
Okay, Dr. Odhis runs a facility in Embakasi. That's Pipeline to be precise. The facility is called Vision Medical Clinic. And in Vision Medical Clinic, we deal with a lot of conditions, irrespective of the fact that I'm a gynecologist. I'm also a general practitioner. So I see different types of clients. Yeah, so I see different types of clients, but I major in the gyna part. So for this, Dr. This, that is an alumni of Masen University, where I practiced the gyna. But before that, I was a general practitioner. You know, when you go for the gynecologist part, that's now when you specialize. But before that, you are a general practitioner. Yeah. So I think if anybody wants to see Dr. This, they just have to come to Embakasi. Yeah, that's why I run the facility, and that's where I offer the services.
Okay. Yeah. Okay, today we are going to dive in a perspective here, like a mortician and a doctor.
Yeah.
Yes, hiyo mambo ya gyno tutaingilia hiyo pia. But nataka tu tuangalie what is your perspective as a doctor and my perspective, do we match hapa katikati? Because before kuwe sasa specialize in a gynecologist, So ulikuwa daktari kwanza?
Of course, yeah.
Ndio unaanza na daktari and then sasa ndio you specialize. Yeah. So kuna hizo maswali ambaye ziko mingi sana. As a mortician, tukikuja pale kwa hospitali and the hospital has mortuary. Does your facility have mortuary?
Currently, we still don't have that. Yeah, but as part of my time, I go to other facilities. Yeah. That got the morgues, and so I tend to interact with a lot of patients, both the live and the dead ones. Yeah.
Oh, okay. There's a view kwamba the doctor who hapendi kuona maiti.
I think it's just other people's opinion. Yeah, because there is the only difference between maiti and somebody who is alive. It's just the life taken out of the person. Yeah. So before somebody, okay, maiti is just a body. Yeah, that is lifeless. Yeah. But remember, before someone becomes lifeless, we have to come to something called ischemia and hypoxia. I think you know that. Ischemia is when you stop the blood flow, the blood stops flowing to the vital organs, also the heart, the brain. Then the brains undergo something called ischemic attack. Ischemia is now when the blood does not flow to the brain, and so the brain cells die. Now we talk about the ischemic attack. And remember, from before the ischemia sets in, the blood flows to the brain. And as the blood flows to the brain, it carries with it oxygen. And so when the oxygen cannot also reach there, we talk about hypoxia. So there is a ischemic hypoxic attack that makes the brain cells and other parts of the body. So I think to differentiate between the two, we are all dealing with the same body. The only now the difference is one is alive and the other one is dead. Yeah.
And because the lack of oxygen
and the blood supply. Yeah.
Umeanza vizuri sana. Kuna times naona unatumia deep. So wacha nichukue kalamu na karatasi. So when it comes to pale kwa hospitali,
yeah,
the doctor is only person ambaye is allowed person ambaye who ana declare someone's dead.
Yeah.
Can you take us hapo juu the moment kama nafanya kwa facility ambayo iko na morgue in hospital, mimi kazi yangu tu nitadili tu na the dead.
Yeah.
Nitakuwa na goja naso walete mwili wanieke pale.
Yeah.
Sivyo? But that process ya pale kwa bed, because the doctor now ako pale.
Yeah, to certify.
Yeah, to certify kwamba yes, the deceased, yes, akwa hiyo yake imeisha. So can you take us that process?
Okay. In most instances, people have confused between somebody is dead and somebody is in coma. There is the dead, then there is somebody is coma, then there is something called the semi-comatose. But these are things that you need to understand, that when somebody is dead, we have to start looking at the vital organs. So, the heart cannot continue beating when somebody is dead. So we look at the cardiac activity. The cardiac activity, you can get that through auscultation. Auscultation ile unachukua stethoscope. Ile kitu madaktari wanaweka kwa masikio, then you put it on the left side of the heart, of the chest. Then you listen to the heartbeat. The heartbeat, if they are present, that person is still alive. So that is with that one we call it the cardiac activity. Yeah. So the cardiac activity is when now you will be in a position to appreciate the cardiac, the heartbeats and the So when you auscultate the chest, then there is no cardiac activity that can be felt. Then you should know that the heart has stopped beating or the heart has stopped pumping. Once the heart stops pumping, what does it tell you? It tells you that there is no blood that is reaching the vital organs. Remember, there is something called how the person dies. There are some parts that dies first. The body has a mechanism that when there's a little of the blood supply of the oxygen, there are some vital organs that must get that blood. Also the brain or something like that. But in some cases, there are the places that are called the peripheries. Now the peripheries are like the foot, the limbs, mikono. That's what apata. Somebody is still alive or is half dead. But still, somebody is half dead in a way that he cannot move the limbs. The limbs and the peripheries, the hands, the limbs are all cold. Meaning the coldness of the limbs or the peripheries, if I may say it that way, tells you that there is no blood supply reaching those organs, that is. So the body will only be taking blood. The heart will be pumping that blood to the vital organs. So the very moment somebody is in the ward, and then we are called to certify if that person is dead, we have to at least check the cardiac activity. So when we check the cardiac activity and we realize that there are no cardiac activities that can be appreciated, then now we go to other things. You look at the pulse. Yeah, so the pulse, you can get pulse anywhere. You can get it juma ya shingo, you can get it kwa mkono. Yeah. So those are the places that you'll get the pulsations. If the pulsations are also missing, then this person is not alive. Then also there's something that you should also check, the respiratory. That one goes without saying. The respiratory, you'll just see how the chest moves. Because when you inspirate, we expect your chest to up and down. Yeah. So if that one is absent, that one can also notify us that somebody is dead. Then there is also something called the constriction of the pupil. The pupil, the eye, the smallest part of the eye. There is how it reacts to light. Yeah. So when you put the light kwa macho, then the pupil should become smaller. When you withdraw it from that light, it becomes bigger. So when it reacts to that light, then you say that person is still alive. But the very moment you put the light kwa macho, then the pupil is just there. It does not respond to the light. Then that person is declared also dead. Yeah, so we check on the cardiac activity, we check on the respiratory, then we check on the pulses, and then you confirm with the constricted pupil.
Okay, in morgue, ile nimepata nayo sana ni ya macho. Yeah. The light one. And I was using the old one, ile ya kunachukua the mirror and you put near to the nose. Yeah, when you see the moisture. The moisture meaning unajua hapa kuna dalili. Yeah. And so hiyo ndio process. So and hiyo umeelezea the science of dying, the whole process of dying. Umeshaitandika yote tu mara moja
hivyo sasa.
Daktari
very fast,
unaenda mbio. Hata before audience hata tufike huko tafadhali. So doctor, what are the myths about death?
I think there are a lot of myths about death. One, they say that death is accidental.
Yeah.
No, not all deaths are accidental. Some people know that they're going to die. Also, when you are diagnosed with the cancer, yeah, you are diagnosed with the cancer at early stages or even at advanced stages. You'll just simply know that the cancer has metastasized. That is the spread. You know, before somebody is diagnosed with cancer, these stages. But if it is at advanced stage, in its advanced stage, then you'll be told that you have cancer, it is stage 4, it has metastasized. When we talk about metastasis, means it has spread. The spread, there is organ to organ spread, and then there is even something called the hematogenous spread, which is now the blood spread. Now, tuseme umekuwa diagnosed with the cancer, na umeambiwa uko na stage 4, na ime spread to the lungs. What do you expect? You know, you are going to die. Because so long as something has become a hematogenous spread, it means that it can go to all parts of the body. You know, if there is one part or the organ that is here that is cancerous, if there is an adjacent organ, it can spread through organ to organ, you know, because of the adjustment. But if it is now through the hematogenous spread, meaning that it is now through the blood, it can travel anywhere. When somebody has been diagnosed with cancer, they'll be told this is the end stage or the last stage of this cancer, and so you have to prepare. So that is not accidental. Yeah, there are some that you may be traveling in a car, then there is an accident. When you least expect it, we can say that is accidental. But almost everybody prepares. And to some people, they'll even tell you that before something happened, I had already felt it.
I knew.
Yeah. So I don't think if that is death is accidental. Then another myth about death is that death is painful. Not all deaths are painful. Yeah. Do you know why not all deaths are painful? Assuming you have a very bad disease, or to say even the last stages of HIV and AIDS, and so you are there, at your last stage of HIV and AIDS, and your people are in a position to give you the palliative care, you'll not feel any pain, because you'll always be put on medications so that you don't feel the pain. So not all deaths are painful. Yeah. Then there is nothing like a good death that when somebody sleeps and then he dies.
That's a good death.
It's not a good death.
I'll smile.
They struggle before they die. So you don't just, let me tell you something. Let me ask you something. If there is anything that wants to take the breath out of you, you must struggle.
So I cancer patient but what a struggle.
Because of course they will. Let me ask you something. Assuming you stop breathing or somebody closes your mouth and the nose, what will you experience before you give up?
Lack of oxygen. That is painful somehow.
But you'll still struggle. What happens when you can't breathe?
There's pain.
There is pain.
Yeah.
Now, assuming somebody has slept overnight, then maybe they aspirate, and now they cannot breathe. They'll struggle before they die. It's only that us that we did not see them struggling, we'll say that they just slept and that's how we found them dead. So we cannot find them to tell their story how it is. But anything that is taking life out of you, you have to struggle.
Well, hapo naweza uliza kuna watu ambao wanaanguka from tall buildings.
Yes.
Nasikianga wao wanakufia katikati hata wafiki chini.
No, they don't die. Hawakufi katikati. The only thing that happens, they become unconscious.
Or wakiwa katikati.
Yeah. It is just being unconscious. You are not dead. You're still breathing. Yeah.
Nasamanga akifika chini already alikufia hapa juu lako.
Not really. It's only that when you become unconscious, you know, when you become unconscious, you become less, you're just there. But not that you died. No.
Na mshtuko? So huyu mtu wa mshtuko alistuka tu.
Now, kuna mshtuko. And kama kuna mshtuko, there is how it happens. There is the mshtuko comes with the cardiac arrest. Because when somebody kama wakati mshtuko imekuja, it makes the heart beat very faster. And when the heart beats very faster, it will even limit the oxygen and the blood supply. And if the heart is deceased, or when you are to say, if you are somebody who had already been diagnosed to be having any cardiac conditions, and then the heart beats that faster, then the heart can stop beating because of something called the cardiac arrhythmias. The arrhythmias now, the heart will now, you know, there is the lab and the dab. Let me tell you that. The lab and the dab is when the heart pumps. When the heart pumps, the blood goes to all parts of the body. When the blood returns to the body, then that is the dab. So there is the lab dab. Now, when the heart contracts, that is, it pushes the blood. Sawa. And this blood that is pushed should go to all parts of the body. Assuming somebody akushtue, and then it beats haraka, then it will fail because there is no blood that is going to be pumped. Yeah. There should be enough force to pump that blood.
Nimeivuta bangi. Na nikafeel roho inatandika. Pia hiyo inaweza cause.
No, those are just that is a stimulant. That is a stimulant. So what you felt is something called the palpitations. And that is as a result of adrenaline. Yeah.
Unasikia tu inaenda.
That is just adrenaline. It's just like you are walking at night, then somebody akushtue. What happens? The heart beats. And what is the work of adrenaline? The flight or fight. Yeah, it gives you that instant energy. It's either you fly, there's flight, or you fight back. Just like to those who are participating in 100 meters, what happens to them? Where do you think they get the energy for the flight? Because that is now where the adrenaline works very fast. Mtu akikuchokoza, do you know that sometimes mtu anaweza akakuchokoza, then you just feel like unaona tu giza, then you start fighting immediately. Or the heart starts beating then. Yeah. Now that just gives you that energy for that time to act.
So it is not the devil.
No, it's not devil. Unajua devil ajaipewa nafasi at least
ajitetete, si ndio? Shetani aliniingilia tu nikasikia nimechapa ngumi. Daktari. I'm loving the conversation. So another question. How faith culture and affect the belief in death? Culture and faith.
Okay. I think death, according to the science part, death must happen. Yeah, death has just to happen because with our bodies, the body sometimes it gets worn out. Our body parts, the organs, sometimes they get old, and so somebody has to die. But to some extent, the culture, like in my culture, they'll say that if you buy a very nice car, you can be killed.
Doctor of
And it
this
happens.
can be killed.
Though
if you build a big nice house,
yes, they'll say that now, he has built that good house. Let's see what will happen next.
Hata ingia.
Yeah. But sasa that one, I don't believe in it. But I see it work. I don't know if it is there. If it works, I don't know. But
it works.
Yeah.
So when kuna like some community who are they don't practice things to do with postmortem.
Yeah.
Na before tuingia hapo kwa hiyo community, ningependa utueleze wewe as a doctor. What is the importance of postmortem?
I think with the postmortem, lately there have been a lot of cases. Let's assuming you leave your friend somewhere, then the next day you find that person dead. And knowing very well that by the time you left the person, he was in good condition. He had not complained of anything. Then the next day you find him dead. It must raise us some suspicion. And so here is where the postmortem now plays a very big role, because when now you want to know the cause of the death, when you have to know the cause of death, at least the postmortem is going to help, because when you do the postmortem, it's going to show if it is as a result of either an assault or or any other thing that may be related with it. If there was any bleeding that can be seen through the postmortem, if there were any blood vessels that were injured, if as a result of strangulation, all those are going to be seen via postmortem. So I think postmortem is very important in as far as knowing the cause of the death is concerned. So it's very important, because there are some people that they'll say that somebody has been killed, and so you can be accused falsely. But once the postmortem is done, it will rule out whatever thing they thought that had killed this person, and so you may be set free. So I think postmortem in our current generation and the society, it plays a very major role.
Speaking of that, kuna this show ambayo inaendeleanga Murder Tips. And there's a victim ambaye alipewa pesa akasema kwamba ameua. But after 1 year, before akuwe jailed, postmortem ilikuja na yeye alikuwa amesema negative. Yeye alisema alirape. But postmortem ilisema aligongwa, huyo the madam aligongwa na kitu hivi. So inaonyesha kweli postmortem ilikuwa ili differentiate na the guy who was accused of killing. True. So hapo kweli inasaidia, but unajua the community, a lot of people huwa wanachukulia postmortem very expensive thing.
I think they're right. Okay, assuming somebody is already dead. There are people that believe once somebody is dead, is dead. However much you are going to do the postmortem, it's not going to bring this person back to life. So instead of incurring a lot of expenditure trying to do the postmortem, they just opt for just burial, because the person is already dead, unless this person has died under some very bad circumstances that is raising suspicion. Then I think that has to be done, so that at least the members of that family to be rest assured of what has killed their own. But in some cases, the postmortem, for instance, let me ask you something. Somebody has been involved in a road accident and is dead. Why should we do a postmortem? He's already dead.
To confirm
which
party was more injured.
How is that going to be helpful?
Because kuna wengine wafanyanga accident na waumii.
No, this person is dead. This person is dead. And the person is dead, that there is an RTA, road traffic accident. Trying to get to know what has killed this person. The person is already, it was RTA.
So we are assuming how many people have been in the same cases are not dead. So we want to be specific.
What has killed this one?
What has killed this one? So hiyo ndio the purpose of postmortem. Because kuna wengi wamekuwa kwa hiyo process
but they never died.
Yes. So what triggered this one
to die?
To die. Ama anatetea pesa.
Can I ask you something? Assuming somebody is involved in a road traffic accident, and then this person gets multiple fractures, or even head injuries, and this person has bled, internal bleeding, anything like that, and then the other person has been involved and has not sustained any internal bleedings,
but dead also.
Not dead, but that one is dead.
So ndio hiyo sasa the purpose. Another thing pia, I think postmortem mali kama in term of accidents is about insurance.
True. That's true.
So when anything that goes to court, lazima postmortem ifanye ndio tuweze kuwa like haya, we can sue the company according to the postmortem results. So mostly is about the court cases, according to me.
But do you think it's important in such cases? I think postmortem is going to be important.
It is important in some cases.
Some cases.
In some cases. When it comes to things like accidents, accident itakuwa important juu ya hiyo insurance. But kuna zingine unaangalianga kama za risasi zijaiona evidence yani after what ulipigwa risasi, so imeenda. But some cases ambaye kama there is the outbreak of weird disease. Kama sasa tuko na outbreak of, I mean, is it what pox?
Smallpox.
Unaona vitu kama hizo sasa. Hiyo ni kudhibitisha kwamba is it this. So hapo pia itasaidia so that we can take the yani tuweze kuji-prevent from.
I think the postmortem should only play a role when somebody loses his life under unfamiliar circumstances. For instance, you just find somebody dead. Assuming somebody is diagnosed to be HIV positive, then he dies. Should we do postmortem?
Alikufia wapi?
No. Kwanza, the person has had HIV for a very long time. He has been eaten off by the virus, and he dies.
So by the time alikuwa hiyo ni stage, hiyo ni unajua ni stage kwanza imeendelea sana.
Yes, amekufa.
Hiyo akikufa hiyo hapana. Twende tu.
Why can't we do it?
Because you can never sue HIV. How will you sue HIV?
So meaning that unless somebody dies under some circumstances that are raising suspicion,
we are there.
Yes, that's when we can do. For instance, let's say the cases of Rivial. The body
is a must.
That is a must.
Yes.
The cases of Shakahola, that is a must.
Shakahola, okay, ni must. The police iko ndani. But so how are you going to sue the government?
It's going to be hard to sue the government.
Yes, so zingine za government.
But you can sue the government in a way that if for instance the case of the Shakahola, right? You can sue the government because the policemen are always there to give us the security.
Okay, I think you can sue it if we are in America. Kenya tafadhali, bado hatuja grow your level. We are still there hapa chini. So doctor, you being a doctor, umeipatana na weird request?
Request. That is very general. Which type of weird request?
Weird, ndio maana unusual.
Yeah, there have been weird requests.
Unusual.
One, there's this request that I ever had from a certain man. He came and told me, "Doc, I'm bringing my partner, but don't test my blood for the HIV. Take yours and test. Then you say that is mine." So then
alikuwa analipa ngapi?
Hakulipa do kwanza, alikuwa rafiki yangu.
Na kukulipa?
Hakunilipa. Nilikataa.
Ulikataa? As a doctor.
That is professional ethics. You don't do that.
I tell you.
So
najua kama ingekuwa tu wengine hapa.
So
with the opinion say hi.
So that's the guy came, said, "Doc, take your blood. Take with that the ladies. Assume that you're taking mine. But ukienda huko ndani, take your own na upime."
If you were sick.
He was sick already. No.
But yeah, kufanya.
Maybe he had a lot of need with me. A lot of trust. Maybe. Because if somebody tells you, doc, kindly do it for me, then I never did it. I called the person and then I asked, why do you want to do that? Eti ni unajua nilipimwa lakini your result haikutoka vizuri. Then nikamwambia, what you do, if you're not ready to be tested, don't allow this lady to be tested. If you're ready to be tested, you two should be tested together. You know, it is voluntary. You cannot force. And again, nowadays people make a lot of mistakes, by the way.
Nataka tuingie hapo. Na ndio swali ambayo tunaingilia hapo.
Another request. Another request. There is this type of patients that have had chronic conditions. Maybe diabetes, maybe to talk about sickle cell disease, maybe let's say hypertension or cancer. Yeah, that there's a time that these people have undergone a lot of pain until they cannot bear it anymore. And so sometimes they may request if you can give them that painless death. Yeah, they just want to die because they're now, they cannot bear that pain anymore.
And is that a weird request?
It is.
Why?
Because you're taking a life.
But I mean,
you know, we are trained to save.
You are trained to save,
not to take.
But now, for me, I'm asking, give me the drug so I can go.
What if there's something that can be done so that you don't go?
So if there's nothing that can be done,
you still be given the palliative care so that you don't feel the pain.
But
so that when your time reaches,
sina pesa. Maybe naangalia account yangu, sina pesa ya kuendelea ku take this thing.
That one you cannot. I think the relatives who are there.
Yeah.
Yes.
Okay.
You know, you can say you don't have money. What if your relatives are ready to pay for that money?
Na kama unaona tu wana waste pesa na eventually nitaenda.
The pesa si yako, ni yao.
Na mimi naona ni kama
no, don't unless they complain.
No, niko like wanaekelea hapa kama this incident ya kuweka mtu kwa ICU. Na unaona tu hapa hakuna hope na pesa inaendelea. Because ICU is very expensive.
When it is in the ICU, these people, most of them, they're in either coma or the semi-comatose. And so in this case, they can't talk, or they cannot nini by themselves. And that is where somebody is being declared clinically dead. Yeah, clinically dead. Meaning the whole body is dead, but just the brain, ndio bado iko a bit functional, but almost going to the terminal stages. So in this case, the patient will not be in a position to request for that, but the relatives. And before the relatives does this, you as a doctor, you should explain to them. But now in our country, I think we have a very big problem in a way that we just want to make money. Yeah, so we'll have in ICU for a very long time. As we get a lot of money from it. But in some cases, I think it's a good thing the best thing to do is to talk to the relatives. Now, Wambie, this person is not going to make it. Yeah, this person is not going to make it. And so they can now give you a go ahead, at least switch off the machines. Yeah, the life supporting machines. Yeah, because if you don't switch off the life supporting machines, it will still survive. But now, mpaka lini?
Yeah. Umesema hapo kitu kizuri sana hapo. Umesema kwamba ni pesa. The problem with our team.
Yeah. People just want to make money.
Yeah. So kuna incident doctor anaweza angalia one the patient cannot survive.
Yeah.
Totally. Yeah. Je, akona ruta ya kuambia familia?
Of course.
And how?
You know, this one you have to be convinced. Because there are some cases whereby some people have been declared dead or not going to survive, but later on they survive. So there are some parameters that has to be checked. Which condition are you dealing with first? Yeah, and all these vital organs, are they still functional? Because there are some vital organs, when they are down, the entire body goes down. Yeah, so there are some basic tests that should be run. Remember that there are some conditions that when you are in the hospital with some types of conditions, doctors will run some tests and they'll tell you, you're not going to survive in the next 2 or 3 weeks. They know. Yeah. So when you see that the kidney starts failing, the heart starts failing, the liver, and then anything that goes to the brain and everything is deteriorating, just know that that is a very bad sign. So this is the time that the doctors will call the relatives, and then they'll try to explain the condition and the situation of this patient so that they get prepared. Yeah, they get prepared. Remember, for instance, ile case ya Bob Colimo. I told the family members that I'm not going to survive past this time because he had already been seen, he had already been scanned, and also they had already seen how far the condition alikuwa nayo ilikuwa is just spread, you know. So in such cases, it's always good to speak out. You tell the relatives so that they can know the fate after all. Yeah.
No, wewe ni daktari na unahudumia patient.
Yeah.
Na umeona kweli ama unafanya juhudi yako yote the patient to survive, sivyo? Na ukapata kwamba yes ameenda. Do you have that effect ya baadaye, like
must be remorseful? Yeah. You know, as a human being you have to be remorseful unless you don't have a soul. Yeah.
So how do you cope up, you as a doctor in that field? How do you cope up with such incidents?
I think what happens, just like when you, as a person, you are convinced that you've done your best, you'll not feel bad about it. Unless there was something that you ought to have done and you failed to do it. But once you do your best, you've done all things that were within your reach to make this person survive, but he fails to survive, you'll be proud of whatever thing you've done. But if it happens as a result of negligence, then you'll hate yourself for that because you'll be like, I ought to have done that, but I never did it. So there are some cases whereby as doctors we become so negligent to an extent that we cause lives. Yeah, that one happens. Yeah. So in cases like that, you'll hate yourself or you'll blame yourself for that. But once you do the right thing, always you'll not regret. Yeah.
Na una ndoto unaotanga usiku.
No. I think from the time you start training and the types you're training yote mpaka uone the number of deaths almost always every day you see. So it
is normal.
It's normal to sometimes, and that's why some people complain. Let me tell you something. Have you seen a situation whereby there is an accident that has happened and people are brought that emergency room and everybody is crying there, and utapata there is one that is bleeding profusely ama mguu imekatika and hahudumiwi wa kwanza, wanahudumia ule mwenye amenyamaza kabisa.
Wanasemanga ati huyu ana kelele, huyu aumii, ule amenyamaza ndio ana.
So huyu mwenye akona kelele bado all the sensories zake ziko intact, that's why ana feel at pain.
Okay.
Yeah, so he's very okay. Where is he kufa? But the very moment you see somebody is there,
huyu ametulia sasa.
Ametulia, that is now the most critical one. Or assuming you are in an accident, that you've been involved in an accident as a group, then their legs are broken, they're bleeding, but you are there, you are just seated. You don't even blink, you're just seated. They'll attend to you first. Because that one, CNS, the central nervous system has got the impact all direct. Yeah.
So ukienda hospitali kama unaumia, unaenda tunatulia.
Tulia.
Watakuja kuku.
Yes, tulia tu. The noisy ones are always being attended to last.
Ndio maana hiyo swali linakuanga watu wako na madharau sana.
Yes, si madharau by the way. You know, the very moment you say that nilienda hapo nilikuwa naumia, they wouldn't do anything for me. We know. The moment you still complain, you are still okay. Bana mtu mwenye anasikia vibaya huwa waongei. Yeah, they're just quiet.
Hapo umejibu. So, doctor, you as a doctor, as certified doctor, what have you learned about life and death? Do you see like Kenya tuko ile design ya so death mingi za Kenya, is it because we are ignorant ama disobedient of some things? How have you learned about
I would say as Kenyans we don't love ourselves. Most of us. Yeah, we don't love ourselves because you'll find that something is bad but you'll still go and do it. Yeah. you know something is bad, you still go and do it. So there are things that we bring to ourselves. Again, I think poverty also plays a role. Yeah, because there are most of these conditions in si tunapata as a result of the poverty. We go an extra mile to make a living. There are some places like tuseme, for instance, when you work for these factories or industries penye kuna a lot of fumes, chemicals, you know, these things can cause a lot of problems, including the cancer of the throat. Yeah, but now that because you have to feed your family, you have to go there and work. So I think as Africans, we have a very strong immunity, but to some extent, we expose ourselves to a lot of some bad things that causes us our lives. Yeah, so it's ignorance and poverty. Those are the two main things. Because utapata, for instance, we always tell ladies to go for the pap smear. Pap smear always diagnoses early stages of the cancer of the cervix, but they don't go for it. So you find that somebody has had some problems, then they keep quiet. Then later, when it is now becoming severe and severe, they go and then they get diagnosed with the advanced stages of either stage 3 or stage 4 of cancer when they cannot now survive it. So there is ignorance and poverty. Yeah. So with the poverty hapo pia inaendana the types of foods that we eat. Alafu Kenya pia tunapenda sherehe. Sherehe pia
tunajaribu kutoa ile poverty na sherehe.
Na sherehe. Alafu then you mess up again.
Sasa ndio tunaingia hapo kwa ukimwi.
You become negligent.
We have ignorance. We were partying to avoid
yeah, so
because I think party is one thing ambayo huwa inatend like we want to forget. Wachana na hizo mashida jibambe.
But do you think when you party and drink you forget?
Some extent maybe inazima tu ile.
Then
inaamuka.
So that one is not a solution.
So here's the solution.
Yeah.
Sasa hebu tuingie hapa kwa hii. Sasa nataka nifunge kitabu. Naona maswali zangu nikao umejibu.
Sasa ulize any other things.
Sasa ndo nataka kuingia hapo. Hapo kwa party. After party ndio jamaa alienda Kames. Akapatana na ugonjwa. Na wewe ni daktari wa Gynaecologist. Since uanze practice your career in pipeline. Ni cases gani ambayo mengi umepatana nayo as a doctor?
A lot of cases, but mostly they're related with the STIs mostly. Yeah.
So far sasa tunaweza simama hapa na tuseme Embakasi STI inatembea vibaya sana.
Vibaya sana. Because people share women and people share men.
No, so we sharing both. Sharing.
Sharing is caring. So when you have gonorrhea, then you give it to me, you are now caring.
Tusaidiane tu.
No, sharing is caring. When you share with me your gonorrhea, is it caring?
Tunasaidiana. Mwanaume kidogo kidogo kila mtu apate.
No, is it caring?
Kidogo kidogo kila mtu apate, doctor. Kidogo kidogo kila mtu apate.
It depends. What is this that unapata?
Let me tell you.
Is this something that is bringing you happiness or sadness?
Kwanza kuna kitu iliniuma siku moja. This is a true story. Sijui kama utatoa. Nilitafuta dem, tukaenda and then CD kapasuka. Na ilipasuka before hata. Naenda kuingia ikapasuka. Nikiwa nimeguza nini? Skin. Hapo juu sunatoa the vagina. Nikatoa haraka.
Iliingia ama
ilipasukia hapo nje na ingeenda kuingia. Naenda kuingia doctor.
Yeah.
Ndio hii mlango naenda kuingia doctor. Unaelewa? Sikuingia. Iletwa hapo. Unaelewa? The following day ikaanza nikaenda kukojoa nasikia
unasikia some pain.
Si pain ilikuwa tu ni ile
itchiness.
Mpaka unafurahia nikawa unamwaga. By jioni naona imezidi. So when I went to the hospital, nikakimbia haraka nikaambiwa ni infection. Daktari aliniambia enda ulete huyo
mrembo.
The moment niliambia huyo mrembo hivyo ndo aliniacha. Yes. So kuna hii tabia mnakuanga nayo. Lazima ulete mrembo.
It's always good that way.
Na huyo kwanza anajuanga amekupea ama amekako nayo.
Some of them are also ignorant, they don't know. They're just there.
Because ni wapo nikajua kumbe
you should know,
carriers.
You should know not everybody loves himself. There are people that they don't care. There are people that can be diagnosed with these STIs, the UTIs, they don't go for treatment. Yeah.
And they are carriers kwanza.
Yes. Once you get involved with them, you get the infection immediately. Allow the infection become so severe because they have it in chronic state. It's something they have had for a very long time. Or you'll find that when they have this infection, at one point they have used some other antibiotics to treat the infection like ashindikana. So what happens? You'll get an infection that you'll be trying to treat and it will be very hard. Ipone. Reason being, this is going to be multi-drug resistant infection, whether is it bacterial or any, but because it has this lady has used a variety of medications and it has not responded to it. Remember, some bacteria they develop resistance. Ukiona umetibu na dawa fulani, then you stop, then the wanajua that is the drug that was used, so they develop resistance against that. So they use that that drug again over and over again, it will not help, and that's why we'll come to something called misuse of antibiotics. Yeah.
Okay, so before tuende hapo, why do you guys overcharge?
Overcharge?
Ikifika hapo.
When cases to do with the STI, si ni msiba wa kujitakia, lazima ugaramike.
So, kufika tu nikaambiwa ni shindano moja, lakini shindano moja ni 5,000.
Yeah, it
depend me.
It's good because when it pains you
for 1 month.
You see now they helped you.
For 1 month I didn't direct.
But they helped you.
You overcharged.
It should be overcharged. So that before you go and point, you know the repercussions.
Hata ikisimama nilikuwa napiga ngumi.
Relax,
wacha ujinga.
Sina 5,000 sasa.
Hiyo ni rent. So take us through. Umesema pipeline hiyo STI iko ina circulate. Na pipeline ndio mahali nasemanga huwezi kuwa dry spell. Ndio hata sasa tukitoka tu hapa nje.
They sell.
And they are selling. And as long as you have people who are selling,
and
the
willing seller, the willing buyer.
Yes. So dry spell iweze kuulemba kasi.
How now?
Juu kila mahali iko. Na hawa ni wale wana sell na kuna wale sasa wanapeana tu.
Hata kunyonga pipeline ni ngumu.
Ni ngumu sana.
Utaanzaje?
Utaanzaje unanyonga? Unaona?
Lakini kama una pesa na pia una vibes.
Nasikia huko hadi tuna bargain. Pipeline we bargain.
Una vibes.
Hapa hakuna vibe. No, imagine wewe unaenda kumuomba ukubai. Unaenda kuwa.
By the way, unajua
how can you vibe?
There's nothing like a vibe.
Ile oya rada do ngapi? Mbia 3 amemwambia mimi niko na tuso. Niko na chwani. Anaambia ni shot moja.
Niko na chwani.
Anaambia twende wapi? Akwambia ndio ile room. Bora hiyo room usiende na simu.
But again, that is how people get infections, including the STIs, because in most cases, a lady that sells sex to you will not have your feelings, and so it will be very hard for them to produce that lubricant for the copulation, and so you'll go there when it is dry, and that is where it the increase friction will lead to the burst of either the CD, and if you don't use the CD, the same friction may lead to the tearing of the skin on the prepuce.
Now, let me ask you, hakuna CD zingine za kuanga ndogo?
Depends.
Juu mimi naona kama hii shua inakuanga ndogo.
Sure.
The day I was using.
It burst.
Ilikuwa.
No, not ndogo. What happens is you are rough. You are rough. Remember?
Okay,
let me tell you something. Sidezi kuwa ndogo kama unaivaa. Remember umeivaa mpaka ikaingia, si ndio? Sasa ikuwe tu ndogo wakati una insert. Because of the friction.
So does it mean kwamba mimi ndo niko rough ama the vagina pia iko dry?
You never made that lady wet.
But kuna wale una make wet haraka then tena wanakuwa tena dry.
That is now those are now other conditions that we are going to talk about there is something called the dryness of the vagina, and they're hormonal based. Yeah, utapata somebody has that dryness of the vagina as a result of either hormonal imbalance that is caused by the family planning that they use. Remember, there are some women, they'll tell you that when they use the family planning, they don't have even that sexual urge towards their partners. And so when a lady says that she does not have that sexual urge towards the partner, it means even becoming wet for that partner goes away as a result of the less of the testosterone and something called the oxytocin.
I tell you.
Right.
Now, pia anaweza kuwa overweight.
Of course, it happens.
Na sina kwanga sitamu.
Sasa that one I don't know. You can ask the audience.
Okay, according to me, I think it should be here between.
Yeah, it should be between.
Not dry, not and wet.
Yeah, it shouldn't be too wet.
Yeah, too wet.
But there's some ladies that they're like that. Yeah, leave alone even the squatting. It's not even the squat. They just become overweight.
Overweight.
So that one also happens as a result of your hypersecretions of those fluids from either the Bartholin's gland. Yeah, so kuna wenyewe wako na hypersecretion inafanya the fluid inatoka mingi. But once you know like that, so you use the cam rag. See the cam rag? You don't know what cam rag is? Ile inakaa kama towel, unaweza wipe.
Unaendelea.
Yeah, unaendelea.
So utawipe na CD.
Sasa si una withdraw first ya.
Una withdraw. Si ndio nasema sasa una nini tena unaenda CD.
Of course, kwani unataka kutoa CD?
Unauliza daktari.
What are you wiping? Are you wiping the CD?
Nikuongezee daktari.
By the way, it happens.
Yes,
it happens. There are those that they become very dry. Then there are those that they hypersecrete. So, they hypersecrete. So those ones are always there.
Okay. Tutaanza wapi?
Anyway.
So kwanza, how can we prevent ourselves from easy STIs? Because kuna wengine nisikia kwamba ni kitu hata iko kwa blood. Anapata the story I was listening and I was told kwamba aliona tu pimples kametokea kwa vagina and akajua tu ni normal. So mara ya kwanza hata hakuwa na shughuli, lakini baada after sex anasikia inamuwasha sana. So akaenda akakunywa tu dawa hivyo ndio umesema hizi antibiotics kakapotea. After 6 months akarudi tena kwa game. Bila rudi kwa game ile pimples ilichupuka na ikakuwa kubwa. Ending up alienda hadi theater kuchinjwa itolewe. Kuna terminology zilitumika hapo. Na hiyo vile ilikuwa inatolewa iko na usaa. So ikakuwa like iko kwa damu sasa. Na anybody ambaye atalala na atampea na atakuwa carrier. So how can we prevent such incidents?
1, you abstain. 2, you be faithful to your partner.
Ngoja bwana.
You can't abstain.
Okay, sawa. Ku abstain sawa.
Okay. Being faithful to your partner.
Faithful sawa.
Then another thing, before you meet, you get involved with somebody into any sexual intercourse, kind you need to be done for some screening. It's not only about the HIV. By the way, there's something I always tell people, that HIV is not even more dangerous than the hepatitis. Yeah, hepatitis is also viral, and you also get it through the body fluids, through the sex, through kissing, and that's why you should not just kiss anybody. It does not depend. You know, people say that unajua you cannot get HIV through kissing. It is true. You can, unless you have some sores in your mouth. Yeah, but you can get hepatitis through kissing. Yes, and hepatitis, when it goes, it damages the liver, and so you can die very fast, as even to compare to mtu akona HIV and AIDS. You know, so people should embrace screening before they indulge in these sexual intercourses with people that they do not know much about, you know. So that one is going to help. But again, always ensure that you use protection. Yeah, people are sick. There are a lot of conditions. So like that lady you talk about, that was likely to be syphilis. Yeah. So when you do this, when somebody amekunywa tu dawa ajue anatibu nini, sometimes it's there's something called the blood cultures. You culture the bacteria. Unatoa damu inakuwa cultured while they isolate the bacteria that is causing this infection. Then they do something called the sensitivity. Wana test your bacteria with the available antibiotics so that wajue which one it will respond to and the one that it will not respond to. So after doing the cultures, it is going to be very easy to deal with that condition. Unlike just going like nowadays, unapata mtu akisusu anasikia pain ashaenda meza doxycycline kidogo ameenda, you know. So by the time unatumia hizi dawa zote, you don't know what you're targeting, the type of bacteria. And this thing I always tell also my clients that not all antibiotics treat the same thing. Yeah. Alafu antibiotics come with different classes and the groups, you know. So kuna groups za antibiotics zenye ukitumia when you have a specific condition haita kusaidia. So that's why we come to that multi-drug resistance easy bacteria because now there are a lot of medications zenye zimetumika already until now cannot help anymore. Yeah. So before you have sex with somebody, get screened. HIV, hepatitis, syphilis, everything, the urinalysis, urine cultures should be done at least. And again, I always tell also men that you should embrace having sex where there is light.
Kwa light.
Yeah, because nowadays ladies also have things to do with not only ladies but even men. They have something they call condyloma acuminata, the genital warts. Unajua genital warts?
Tuendelee.
Unajua genital warts?
Preach, doctor.
Genital warts ni zile vitu zinakaa kama crops na zinakuwa either kwa the vagina or zinaweza kuja kwa the testes, the testicles. Zina grow ni kama grains za millet, but they are so itchy. It's caused by the HPV, the human papilloma virus, and the human papilloma virus that is causing the genital warts, they have the tendency of even causing another strain of it that causes the cancer of the cervix. Yeah, and it is sexually transmitted. Yeah, so utapata sometimes umeenda umelala na dem, the next day unasikia kuwashwa, ukisikia huku chini karibu na the testicles, unaona kuna vitu zimefura zinaka tudogo
pimples tudogo.
Kama inakaa kama kitu inakaa kama growth, you know, but ina itch.
Unafanya nini kasikia hii?
Herpes is different. Herpes ni kama ile kitu imechomeka. But it is also an STI. Yeah, it can also be got through sexual. But anybody, you see, these people are on the herpes, most of them, before they are treated, they have to be tested for the HIV. Because there are some HIV related conditions that zinatoka through kwa ngozi. Because remember, HIV, what does it do? It only makes you immunosuppressed. Immunosuppression is there is something called immunosuppression or immunocompromised. When you are immunocompromised or when you are immunosuppressed, it means that your immunity has gone down. And that's what the virus does. And so when that one happens, your body will not be in a position to fight any type of infection. And so these conditions zitaanza kukuja kwa the ngozi. Utapata sometimes unaona tu ni kama kitu imekuchoma. Yes. Or sometimes there is something called the KS, but those are now the advanced stages. KS inaitwa Kaposi sarcoma. That one I'll teach you later. That is those are now the advanced stages, you know. The advanced stages of now the HIV and AIDS. So I was saying this before uende kulala na dem, kindly, this is what I always tell my friends, kindly try have sex where there is light, because it is not emergency. But then there is no sex that inakuanga emergency. Mtu umeitisha mechi amekuja. Take your time.
Bash ni emergency.
Bash, that one I think it is for the boys to have sex during bash.
Boy.
But a man cannot have sex during bash.
Yeah, the difference between a boy and a man. Yeah. So hii story yetu unaniambia, unajua naangalia like people ambayo wanaweka mdomo yao hapo.
In fact, that is also very bad.
Na imagine sasa, hiyo ndio na imagine like hizi vitu zote umetaja tu zinaweza patikana hiyo sehemu.
Ushaisikia kitu inaitwa oropharyngeal candidiasis? Candidiasis inapata mdomo ya mtu imeturn whitish. Na gums zinaanza ku bleed. Na ulimi ukiangalia inakaa white kabisa, niko na patches. Those are the candidiasis. Pia unaweza pata from huko, or you can even get the inaitwa syphilis from huko. You can get the yes. You can even get the herpes from huko. A lot of things. So unaona the vagina, there it is. The vagina has a lot of infections. So that's why we take it as a course to learn about the condition from the vagina ikiingia. Yeah. So anything like going down on a man or a man going down on a woman, unless that woman is your own and you know the level of hygiene, because very many women wako na something inaitwa trichomona vaginalis. Hii condition unapata mwanamke anatoa ile discharge inakaa greenish. It's a condition that is bacterial, but it is very hard to treat. Inaitwa trichomona vaginalis. Utapata, that's why nasema before you lali na mtu, at least do examination. Even if it means taking your finger should be clean, of course. Though the vagina si lazima ikuwe clean, because most of them are not even clean. Yeah. So go and nusa. Look at it. Yeah, because unaweza toka hapo na usa, unaweza toka hapo na hiyo something called the bacterial vaginosis. Inatoa hiyo harufu inakaa kama rotten fish. Or unaweza toka na hiyo trichomona vaginalis, ama unaweza toka na vaginal candidiasis, you know. So these are things that you need to confirm. So if you're one person who is careless, you'll go, you start practicing what wazungu wana practice. The next day utaanza unafanya tu hivi leo usiku, the next day uko na sore throat. Yeah, utaanza kuwa na sore throat because you've already got the infection. Yeah. And so we should always be careful when we are handling those things. And let's not practice things that you're not used to. But you cannot impress a woman.
Kwani kuna kuanga na the normal smell. Smell ambayo utajua kwamba iko clean.
Of course there is a normal smell of the vagina. Yeah.
Ni gani?
How do I explain this? It does not smell bad, it does not smell good.
Iko tu hapo tu.
Okay, let me ask you something. Do you know that there is a certain scent that when you have sex, sahi na kupita hivi, tutajua ume have sex?
Nasikia hiyo.
Nasikia guys. Yeah, it is. There is that normal smell. Then there is a weird smell. Yeah, that is very far from the normal one. Yeah. So utapata there is a smell that
then ati umesema there is the normal smell.
Yeah, then there is a weird smell. Okay, something that is normal does not irritate. You don't feel offended whether yeah, but kuna ile that is so abnormal. Yeah, that smells bad. Vagina does not smell bad. Any vagina that smells bad, it has infection and it has to be treated.
Okay.
Then there are some women that believe that the vagina must have a discharge. It depends. The only discharge that should come from the vagina is that discharge that it is stretchy and it looks like the mucus. And that one also always come during ovulation or when they are sexually aroused. Yeah. But these are the ones unapata mwanamke anasema kuna discharge, inakaa whitish, inakaa maziwa mala. Those are associated with yeast infection. Inaitwa the Candida albicans, candidiasis. Yeah.
Na imaanishi kwamba anyone ambaye amepatana na hii ugonjwa imaanishi yako like it was transmitted through sexual. Does it mean
Depends.
Nasikianga hadi kwa toilet anaweza enda apate.
You know, mwanaume cannot get UTI from the latrines.
Mwanaume ni ngori. Yeah.
But you have to must have sex. But lady anaweza pata the infection ya UTI through choo. Reason being they have a very short urethra and so with any splashing can cause it.
So hapo I do agree with you kwamba kuna hii STI in Embakasi because hata the hygiene in Embakasi ukitoka utwende tu kwa ploti hapo unaangalia tu choo, the hygiene of the
single houses.
Yeah, the single houses unapata they are not well, hakuna maji. So mali kama pale ni rahisi. But kwa man uzuri yake ni kwamba pale haezi pata. Juu ni kurusha.
So what happens?
Tunachora ukuta.
What happens? Most men in Embakasi, they get this infection through their partners. If not their partners, then other people. If there is any case of unfaithfulness, you know, so they can get it from there. But for a man to get it, mwanaume akisema eti nilipata infection through choo, that's a lie. Yeah.
So the chemist in Embakasi mainly a profit from this.
Mostly these infections that are related with the UTIs, UTIs and STIs. That is, let's say like that. And again, the hygiene Yeah, the hygiene. So unapata there are some diarrheal diseases, some stomach upsets, and again because of the hygiene, again most people nowadays are get diagnosed with the likes of the H. pylori, the amoeba, you know.
There's this incident ambayo nimeipatana nayo na nimeikuwa victim. Nilikuwa na hii ugonjwa ya baridi nitangoje pneumonia. And nikaenda hospitali fulani tu hapa karibu na mimi. And nikaambiwa ni malaria, and I was starting given, nilianza kupewa medication of malaria. So by the time nilikuwa na take this medication, sio ni change. Naona kwanza inakuwa more, I'm becoming more weak. So nikatoka hapa nikaenda hadi Makadara pale. Kuna the hospital of the sisters. Ndio kufika wakanipima damu wakapata niko na pneumonia. Nikakuja kuona kumbe most of the hospitals in Pipeline Embakasi area, they are not, I don't know if it's ignorant ama they are not well trained guys, ambaye ni jamaa tu wako na do anaamua tu kufungua biashara. Na pia ndio hiyo unapata hata ukienda hospitali ama chemist uenda kumwambie niko na homa, ataanza kukuambia kuna antibiotics hapa fulani na fulani na fulani. Na ukimaliza hiyo moja na ikosa urudie pale atakwambia hili kata ya jaribu hii. How can we prevent such things?
I think,
and how inatokea wapi kwanza kitu kama hiyo?
I think
I think inaharibia watu ambao wamesomea hii kazi. When ukikaa hapa na watu wengi wanasema nilienda chemist na ile chemist ile ni vala ile hajui kitu anaditibu. Unapata vitu kuna vitu kama hiyo. And then unapata pia kuna hospitali ziko huku when a patient amekuwa admitted, ati a doctor ana bargain na dawa, ati kuna hii dawa ya 4,000 but ukiwa na 2,000 tunawezeka hii.
That is not business.
So kuna hizo hospitali ambaye they are in pipeline. Umenipata? Na ndio like which kind of measures inafai kuangaliwa, because zinaharibia watu ambaye walienda 7 years yao kusoma waka-invest kwa masomo kusomea mambo ya daktari, and then quack doctors hapa and pharmacists wako area.
Okay, I think to the general public, the only thing I would advise them to do when it comes to the treatment of the patient, there should be people should be a little bit keen, because there's something called the history taking. You should take a history of the patient. When the patient comes with the symptoms, like for instance in your case, I don't know how pneumonia would be a differential diagnosis of malaria, because there's something called the differential diagnosis, something that presents almost the same as that one. For instance, I would give you an example. When somebody is being tested for malaria, we also test for typhoid. Because typhoid and malaria presents the same. So if you present with a certain pattern of symptoms, that can only be taken into consideration when history is taken. You take the history. You know, you cannot take the entire history, but it should be at least a short history. You take the history of the patient, the presentation, and how venye amekuwa na hizo symptoms. Then you do a lab test. The lab test should be run at least to get a diagnosis. What happens when you come, you tell me, doc, nasikia hivi na hivi na hivi, I'll have an impression. There's something that I'll be like, okay, I think it is this. That one I'll be making an impression. Then when I have made an impression, what should follow is the lab works. When the lab works has been done, now with that impression that I had, we are going to arrive at diagnosis. But if I've already made an impression, like this inaweza kuwa hii, then umeniambia hizo symptoms, then naweza kuwa na a variety of things that nashuku. So naweza sema hii kama si hii inaweza kuwa hii, and that is what is called the differential diagnosis. Kitu ina present almost the same. And so when you have the differential diagnosis, that's when you run the lab test, you are going to narrow down to the one that is likely to be there. For instance, when you have malaria na umekuja hosi, I'll do the VDRL, not VDRL, but I'll do the Salmonella typhi, examination, and then I'll do BS for MPS, that is blood flight for malaria. So if the malaria is not there, then I'll have to run this one, because it also presents like that one. So I'll have to get a diagnosis after running the tests, you know. But the very moment you present with the unasikia baridi, you know, then somebody just tells you that is malaria. No. At least somebody should ask you, have you traveled out of Nairobi? Because you know malaria is not Nairobi is not a malaria endemic zone. But at least you should get a history, and you could guide through on which type of test you're going to do and the ones that you're going to omit. Yeah. So there are a lot of quacks, and again, the medical field has become like a business, and so people, they have just flooded into the market doing all sorts of nonsense to make money. When somebody is sick, and me as a doctor, I tell you that this is the best drug for you. I should not be giving you alternatives. I should not tell you that, okay, how much do you want? Do you have? No, that is now, it becomes no business. That one is not now life. Now the professionalism comes with doing the right thing at the right time. Not now trying to bargain, you know, treating a disease is not like going to buy mandazi. Yeah, that somebody should tell you nipatie ile ya shilingi 5. No, I should tell you that you need to use this and this, and that's how it should be. Because when you don't give the right medication, the condition that is acute might graduate to become chronic, and so treating it might even end you up having admitted. Yeah, having been admitted. So there are some conditions that should be treated promptly, ndio ziishe kabisa, other than giving alternatives just to get money. Yeah.
Hey, hapo ni kweli. Nataka tumalizie. Ndio. Unataka kumalizia haraka? Audience, are we together? Yes. Before tuingie kwa question za audience hapo.
Yeah.
Niko na swali mtu mbili ningependa ufafanue, and then tuingie kwa audience tukimalizia. Do as you as a gynecologist,
yeah,
si unapatanga sana, unajua tukiwa shule tulikuwa tunambia gynecologist akosangi
nini
wako anapata tu demo amekuja hapo mrembo gynecologist akosi nini sige
no you know something that you call a profession. It comes with the professional.
Mugo wa elimu.
Yeah. Mugo was a quack.
Si ndio nasema
alikuwa now there is a professional, then there is a quack.
I'm Elias Otieno, please. Address me with
So there is a professional, then there is a quack. I'm telling you, it is very hard for even somebody to erect when examining a patient.
So no, do you lose appetite?
This is a patient. This is not your partner.
So when you erect, kuna ile incident unaweza patana upaka hata wewe kuerect katai. Like
it is I think it is it comes with the professional ethics. You know, this is a patient, and the patient needs to be attended to. Unless I think you are intoxicated with some drugs, you can erect for the patient. Assuming you are examining a patient, then the patient gets up and finds you erect. What do you do?
You continue like Mogo wa elimu.
You see, then is that now profession?
That's not professional.
You stop being professional. So these are things that at least these are things that we've studied, and this is one of the area that we indulge in. So we see a lot of vaginas. Yeah.
Hey.
So if it is vagina, you see it now. Assuming you see like 10 patients in a day, you examine them,
10
or you treat them.
10 patients in a day.
Yeah, that you examine them. Will you be erecting for all of them?
I can.
You can.
For me.
Because it's not your. It's not
because it's not me.
Yeah.
Okay. Now, there's this incident kwamba USA baada ya Trump kuingia dawa za ukimwi ziliacha kukuja, si ndio? Anasema hivyo, and growth ya HIV inasemekana ime increase. Pia kidogo kidogo hapa tukasikia there's another medicine that has come ya HIV,
the injectable one.
Yeah, the injected. Manipata. Ebu tueleze, is there a cure for HIV?
They cannot tell you. But anything that can suppress the virus for almost 6 months, It tells you that there should be a cure for it.
So nile like when they get the real thing,
the world the world is made in a way that it has to make money. And people have to die.
Okay.
Yeah. Assuming people do not die.
Where will I eat? Okay. I get you. Huh? So by the time wanaleta hii lazima itakuwa.
Yes, there is something. Yeah, there must be. So let me tell you something. HIV did not just come by its own. Yeah.
It was something that was created.
Just like Corona did not just sprout from anywhere. Yeah. Somebody who made it knows it. But now that because the world is wicked, they have to make money out of it. Yeah. Until the day that they'll be satisfied with that money. Na pesa haitoshangi watu, sindio?
Haitoshangi.
So they'll just be introducing it in bits. Maybe. Yeah, but there is. I'm certain that there is something for it.
So kuna ile design before mtu unasikia umelala na mtu na maybe ukashuku. Nilikuwa napata kuna some medicine ambayo unaweza chukua ambazo zinaitwa hizi mavia ni okay, unaweza chukua na prevent na
there is a drug ya kutumia before engaging in sex and after. But I always ask myself why I would use these medications going to sleep with somebody I know is sick, unless you're my partner. Yeah.
Okay.
But after exposure, there is something called the pre-exposure and the post-exposure. And that's where you get the PrEP and the PEP. So before you go with somebody, but unajua jamani mgonjwa, lakini you're going to expose yourself, you go for the pre-exposure prophylaxis. That is the PrEP. But after umeenda umelimana, then the next day uwezi mpata, unajaribu kumpigia hayuko, ama unaweza mpata lakini mkienda mnatestiwa anapatikana ku positive, wewe hauko positive, unaweza faint na usha have sex. So is faint going to help you? You use the PEP.
Use the PEP.
Post exposure prophylaxis. Yeah.
So question from our audience before tukamilishe
very fast.
Yes. Please, Doctor ako hapa ready to answer you.
Yes, asante sana kwa a very nice session.
Can I give you the mic? Tumpe mic. Another shika tu.
Yes, yeah, thank you very much for a very informative session. Bwana Daktari, I think you're doing very good work to people of Embakasi South and Kenya is at large. I have many questions since the beginning of the show. It's only that we don't have time to ask, maybe because the way the program is. I want to get to know the difference between a brain dead and clinical death. I don't know if I ask you all the questions together, then you give me. Yes, it's the same.
It's the same thing.
Okay. Another question is cancer. In terms of cancer, chemotherapy or radiotherapy. Some people say those things, they even hasten and they can cause more damage than what at the time the cancer would have maybe taken to take you down. So sometimes they say the chemicals, the radiotherapy, they even worse or even
mostly is the radio.
Yeah.
Mostly because unajua the chemotherapy involves the drugs.
Yes.
The radiotherapy involves the radiations. When you expose radiations to a patient that is already having cancer, cancer in itself is immunosuppressant. It makes the body weak. The radiotherapy will not only target the cancer cells, but it will also even target
the healthy
cells. And that's why unapata, to those who are undergoing the radiotherapy, they always deteriorate very fast.
Okay.
Yeah. So when the cancer itself has made you immunosuppressed,
yes,
when the radio is also introduced, it makes even more weaker. That's what utapata somebody is diagnosed with even stage 1 or stage 2. They were all healthy, but the very moment they are now introduced into the treatments, they start deteriorating. Yeah. So it does not spare.
Okay. But is it very necessary? It has to be done.
It is.
Is the case of you are doomed if you do or if you don't.
Yeah, because once this cancer is diagnosed, the management should be intensive because they easily spread.
Yes.
Yeah. So it has to be intensive so that to limit that time for its spread.
Okay.
Because remember, when somebody is diagnosed to be having any type of cancer, then the moment you take you buy time with
Yes.
it,
Yeah.
it can easily spread to the vital organs.
Okay.
And once it goes to the vital organs, now managing it now becomes even
problematic.
Yeah.
Okay. No, thank you very much for that. Also, let me ask you a question about treatment. People talk about herbal treatment, and there's the one for medicine, which is done in the labs. The one we commonly know from the pharmacies or hospitals. They're from India, from US, and other places where the big pharma have patented and selling to people, versus the kienyeji herbal, especially known well in Africa. Yeah. Yes. What is your take on that?
They're all helpful. The only difference is one is purified, one is not. Remember, all the drugs that we take are from the plants.
Okay.
Yeah. So there's one that has already been purified.
Yes.
Then there is one that has not been purified, though they help. But remember that when once you're used to this herbal sana, because it is not purified, it has a high tendency of either damaging the liver or even the kidney.
Okay.
Yeah, because it is not purified. It is in its original form. Okay, so even when it goes, the detoxification of the drugs happens in the liver.
Yes.
And some of them get excreted through the kidneys.
Yes.
So assuming you may take as a bulk with all its impurities, it can easily damage. Yeah. So watu wa kitambo ilikuwa good with them because their immunity was strong. The types of food they were using. But now with this current generation, with the types of foods we eat, when you get these medications that are herbal-like, they can easily bring problems to us. Yeah. But all the medications are plant extracted.
Yeah. Okay. Yeah, because I remember there's a doctor, a friend of mine, he's called Billy. He's saying that he's been educating Maasais and other people to sort of take the traditional medicine, because they are most of them now are having a lot of kidney problems.
Yes.
And the liver. He's saying he's telling them, some of them are started accepting before they thought, just because he's learning from university, he want to bring them Muzungu medicine. He doesn't want to give them the herbal.
What they should be told, they are the same medicine that they have. I think they need to be educated or be taught on how it can be purified and made in a way that is less harmful to the body.
Okay.
Yeah, but they have good medicine. The only thing is that it has a lot of impurities. Okay. A lot of people now it is being stored.
Yes.
The hygiene.
And the dosage.
And the dosage.
Yes.
How will you know that you're taking 500 mg? Umekunywa vikombe tatu.
Yes.
So you can either overdose or underdose. You don't follow even the frequency.
Yes.
When it's supposed to be taken, there's something called the plasma half-life. The plasma half-life is that duration that the drug takes in the body before it disintegrates. Iishe kabisa from your system.
Yes.
Assuming that drug amebeba kwa kibuyu should take like 12 hours or 24 hours in the system, na amekuambia ukunywe mara 3. That is an overdose.
Yes, sure.
So they are good, but the frequency, the dosages, not known.
Okay.
Alafu they got a lot of impurities, and again now the hygiene, now venye zimebebwa kwa hizo ma containers.
Yeah. Ilikuwa imewekwa mkorogo ya jana, inawekwa ya leo. Yeah. So let me ask you another question. The Catholic Church in Kenya is very synonymous in terms of warning about vaccinations, coming from one other organization, from the Bill Gates Foundation, or Clean Health initiatives, all these foreign funded or sponsored vaccinations. Sometimes they say is it inoculation, making some women, maybe some age groups, not get children. Yeah. What is your take as a doctor and being in the field and the research which is there?
I think in the country we have good doctors and we have researchers. There's not just any drug that can be brought and we start consuming it. And that's why we have the KEBS, to check on the quality. And the researchers will also get to know, to at least do 1 to 3 things to confirm if it's good or not. But again, as I said earlier, the world is wicked. Yeah. And killing people is very easy.
Yes.
Yeah. So that's why when any drug is brought into the country, the government takes the initiative of having our own to at least have a look at it before we consume it. But remember, these vaccinations are very important. Yeah, because when the child is not vaccinated, it means that the body is left just like that. There is no any defense mechanism that if at all there is any infection that comes, it will find the body. Yeah, they'll be easily exposed. So these drugs are good, but if at all there can be any problem, I think the government should take the initiative of having our own to look at it.
If the government doesn't like money or is not being used also as a conduit for that, huh? Okay. So let me ask you a question. In US, you find the people tell you have 4 days. I think you mentioned in the show earlier. They tell you have 3 months to live.
Yeah.
Instead of giving goodbye to your people, you have 5 days. You have 10 hours. How do they come to that conclusion? What is there an empirical way of measuring the time somebody is left before they
check
die?
On their system.
Yes.
The vitals. That's what I was talking about.
Yes.
They check on the LFTs, the UECs. The LFTs are the liver function test. What's the derangement in the liver? How does the liver work? What is the kidney? How does the kidney work? How about your brain, the heart? When there is an extent at which the heart, ikifika, this one can fail at any time. And so they don't always tell you the exact day, but they'll approximate that in the next 2 or 3 months, you'll not be normal.
Yes.
Yeah. So it is approximation depending with your vital organs. Venye ziko, how the disease
It's
has
taking
spread.
a toll on you.
Yes. Yeah, true.
So that's the most maybe empirical or scientific way possible to determine that.
Yeah.
Huh?
And that's why, the same way somebody will tell you have acute kidney injury or chronic kidney injury. Yeah. So before somebody tells you that ukona chronic kidney injury, they'll do something called the GFR, glomerular filtration rate. They'll check how it is. So when they see the derangements on the UECs, urea electrolytes, and the creatinines in the liver, they'll tell you this liver is the kidney. They'll tell you that this kidney is failing. Yeah. And that's utapata mtu anaambiwa this kidney is failing. You have to be initiated on the dialysis. And of which, if you don't go for the dialysis, you die.
Yes.
Yeah.
Okay. So, you mentioned something earlier in the program, and you talked about why would you do post-mortem to somebody who died of HIV or accident. I think and the host there maybe gave some views on that. I also think somebody, a friend of yours, or even a spouse or somebody who know that this person, I'm tired of keeping this person. So let me give him poison, because people know already this guy has HIV. Let me give him poison to go. Then we just blame on the HIV, or maybe an accident, maybe like I know you have known the international story, like maybe Princess Diana. There are a lot of theories. They say yes, it's an accident, but maybe something was done before this happened. It's apart from the mechanical checking, the way they check airplanes, accident crashes. They also check maybe this person was given some drug which made him disillusioned, so that he can cause an accident and die on the road. So I think it's still very possible, and the word of wickedness and how things are, I think it's good to be done mostly on nearly every person, but Muslims are doing it. They don't do a lot of it. And I think they leave a lot of room for guesswork.
For the cases of somebody who has had this chronic condition, let's say something like HIV and AIDS. HIV does not just get up and kill you in one day. If you are somebody who takes his medications, who may adhere to the medications, you'll still be strong to be alive. So unless there is that stage imefika na umepata ujamaa amekufa after, but if somebody has just been has adhered to the medications, then it dies all of a sudden, then it calls for. Now that's why we were saying under some circumstances that are raising suspicion, then you have to do the postmortem.
Thank you. To my final question, there are two. Can somebody who is dead have been put in ICU been maintained? Maybe they were pregnant and then the 7th month pregnancy. Now they are maintained in ICU to enable this child to stay alive until the time when they are ready to come out. I have seen something online trending. I think a lady who supposedly died in like 5 months, and they're just keeping her on ICU because she has no child. They just want to have the child. They just wanted to have the child come out so that they can maybe put as a memory for the lost daughter, because they only have one daughter. That is one. And number two, the final one is in terms of cancer and many diseases in the world. I come from the world of technology, and I believe technology is advancing so much. There's quantum physics, obvious, and technology. There's AI and robots, and this is, we are trying to bring all the knowledge and ideas and the researches and everything which has been gotten from many years ago to now. Combination of all the knowledge, like you have good knowledge combined to like all the doctors. So do you think AI and the advancements of technology can be used to like checking on cancer instead of doing this therapy, chemotherapy? Technology can go to deep just to select the particular cells which are infected instead of exposing the healthy cells to problems. Yeah, you can answer those two questions, and thank you very much for Mortician hosting us.
For the case of Nene, for the case of the child, the lady in the ICU 7th month, and then they want to maintain this pregnancy because they have to ensure that the child is alive. Remember the thing that we need to consider, that it is not all about breathing that has to be maintained, and even the blood supply. Remember, there is also food. Yeah, because the child survives on the food that the mother eats. So whether the mother's digestion, is the digestion of the mother okay? Because the mother has to digest that food, or ndio ifike. But remember, somebody is in the ICU, maybe is just there. So maybe ana ako kwa hizo ma NG tubes ya kumfeed, that one can help. Yeah, it can help. So long as the blood supply is there, the breathing is being done with the machine, and the child should be checked. But remember, at 7 months, they ought to have delivered the baby. The baby can still survive. Yes, the baby can still survive at 7 months. The baby survives even at 6 months. Akitolewa na amewekwa kwa incubator. Yes. So I think to some extent, instead of endangering the life of the baby, they just get the baby out. Okay. And then they take care of the baby from the incubators. Yeah. Then in the case of the AI and everything that is happening, I think it's going to be helpful sana in making early diagnosis. Early diagnosis is going to be very easy in making early diagnosis. But now when it comes to the treatments, there are some other technologies, some other techniques that will be employed. But in making the early diagnosis, I will do it, I think. Yeah.
Okay, Doctor, I have one question.
Yes.
On accidents.
Yeah.
You talked about accidents earlier.
Yeah.
I've found myself in some situations. I've seen some. Whenever accidents happen, most probably the first people on the scene will be people around.
Yeah.
Laymen, not medics.
Yeah.
But at times, as a layman, you want to help. But you just lack the means and the experience. For example, I was once in an accident scene in the middle of the night, around saa 8 usiku. I'm seeing 2 injured guys.
Yeah.
One with a protruding bone on the leg. The other one, I didn't know what exactly happened, but he was moving. And there's another one on the vehicle. There you are, no experience, no nothing. You want to help. It's in the middle of the night. What are you supposed to do?
You're all alone.
No, there are people like me.
Call for help.
Or laymen. Yeah, we've called for help.
Yeah.
This is Kenya. You know what is going to happen. Help will come even in the morning.
I know.
2 hours.
You know that.
Yeah.
So here's a situation where you watch people die.
Now, this is what you do.
And there's nothing you can do. But I feel with a little training,
First aid.
just something like first aid and whatever, as you buy time, you try and buy time for life. Yeah, what is someone supposed to do?
For life or for death?
For life, yeah, you want to make someone live.
What you do is first, wherever you are at the scene of accident, and then you see the accident that has just happened, ensure you are safe first.
Yeah.
Your safety comes first. If you're not safe, don't go there. Safety comes first. After your safety, you shout for help. If there is nobody to help, then you try to get these people out of the scene. If there is somebody there mwenye na bleed, for instance, that umesema there's a protruding bone, that is a long bones. Long bones always bleed sana. What do? You take 2 sticks, unaweka, then unatie. It's called the back slab, to make at least that fractured limb iko a bit stable. Sawa. Then if there is any bleeding, try to apply pressure. How do you apply pressure? Chukua nguo yako, tie tightly. When you tie tightly, the blood vessels zita close. Yeah, that is the essence of applying pressure. Then you look for those people who are not breathing at all. If they're not breathing at all because of the accident, they are unconscious, you take your finger, put into their mouth. Because when there is somebody who is unconscious, the tongue always rolls back. Sawa. So you take your finger, put into their mouth, and then you ensure that the tongue is not back. If the tongue rolls back, then it will close the throat, and so even the diaphragm, whatever thing, and so there is no breathing that happens. Yeah. So you ensure that you unatoa the tongue. Then after that, ensure that they are breathing. If they're not breathing well, you can do resuscitation. I think that is one thing you should call me next time. I teach on the first aids, on the resuscitation, how you can resuscitate, how you give a breath of life, how you resuscitate by chest compression, things like that can help.
Basic first aid.
Yeah, but the first thing comes first. Why am I saying that you should ensure your safety? There's a guy that I once treated at Kakamega General Hospital. Aliona mtu alipata accident na pikipiki. Sawa. The very moment aliona mtu alipata accident na pikipiki, alirush cause pikipiki ilikuwa imemlalia katikati ya barabara. Akirush kwenda kumtoa, akagongwa na gari and he got multiple fractures pia yeye. Yeah, so your safety comes first. If you're not safe, don't do anything. Just like in the case of even the fire outbreaks, do not go unless you're safe. Yeah.
Okay, I get you. Now, do you think we are in a modern world? Everything is developing so fast. Do you think the government or the nation should take an action? Maybe it should be compulsory for everyone through the schooling system to be able to perform first aid. Or what is your advice on this?
There's a time I was in a certain live session and I said that if I were I was in a position to advise, I would have said that in the CBC,
you are advising, the world is listening,
that the CBC that is in the schools, the first aid should be taught.
Should be compulsory.
It should be compulsory, because anything happens anytime. You'll not be sure when it will happen, but it will definitely happen. So when every one of us is equipped with the basic life support skills, then it's going to help to save a lot of lives. For instance, I told somebody that there's a lady that I once treated, then now she's not in the country. She told me, I asked her about her last born. Then she told me that she lost her last born. And I was like, what happened? Then she told me that by the time the child was, her child was 7 months, she went to work. She left the child with the maid. Then the child aspirated and the child died. So the child aspirated just milk. So that is aspiration. Milk imeingia kwa the lungs, and she lost the child just like that. So there's some basic techniques that when we are equipped with them, we are not going to lose our lives that way. Remember, there are some lives that we lose just because we don't know what to do to save it. Ignorance. So there are things that I think the government should implement. There are things that we should be taught. You should not even be charged for it. Yeah. So that at least kila mtu anajua, if there is anything that I can do, then it is going to save a lot of lives.
Okay, thank you.
Doctor, tunaendelea mzuri, tunafunga. So how can people find you?
Okay.
Contacts.
I have a YouTube channel, so it is very dormant. It goes by the name Dr. This. They can also find me in TikTok. TikTok, sometimes I run live sessions and I teach. And there also, when you go there, you'll find Dr. This. So TikTok, YouTube, I'll be there.
Okay.
By just Dr. This. When you type Dr. This, you'll find me. And
you're currently located at Pipeline.
Pipeline in Embakasi. That's why I run a facility. Yeah.
You're trying to help us
to treat all those.
So thank you so much. Thank you so much, and I really appreciate, and I hope next time tunajiprepare tena na maswali hivi, tunakaa hapa tena tunakuita.
Hallelujah.
Utatokea.
Hallelujah.
Utafunza hizi vitu.
Vizuri sana.
Me, the only teaching I can give is for the dead.
Next time you will teach us about the rigor mortis.
In the rigor mortis, only that. Thank you so much, and I appreciate it. Until next time, I've been your host, Elias the Mortician, with my guest.